Hi ladies, my name is Jacqueline Weber and we are three of the midwives from CHRISTUS Trinity Clinic, and we're here today to give you your own personal virtual pregnancy class. Today's just going to be really basic. We're just going to kind of go through when you start seeing a doctor or a midwife, what your visits might look like, and answer a few questions of yours. But we plan to have additional meetings later on to cover topics that you might be interested in, anywhere from epidurals to birthing positions, breastfeeding. We have tons of different topics that we want to cover for you. So first, we're just going to start out with introductions. Again, my name is Jacqueline Weber, and I'm one of the midwives.
I'm Dion Kittrell, and I'm one of the midwives.
And I'm Selena Kennedy.
So we have a little slide presentation that we're going to go through for you in the beginning. We also want to first introduce some of our physicians from our CHRISTUS Trinity Clinic. So we have Dr. Ricky Paul, Dr. Dozier, Dr. Weaver, and then all of us midwives. And we are all working here at CHRISTUS. So that is our team. So let's move into first trimester, or actually now I'm pregnant. So what now? Prenatal care. When do you start seeing a provider? Most women start seeing a provider around 6 weeks along based on their LMP, which is last menstrual period. You can know your last menstrual period by the very first date of your last cycle. So that's how that works. If you're unsure though, we can see you at any time. We can do a pregnancy test and just get your information. Some women like to come in right away at 4 weeks and just kind of establish care. You can do that as well. As far as an ultrasound though, we have to be about 6 weeks along for us to be able to see a actual intrauterine pregnancy and really kind of get a dating for you. So we typically don't do an ultrasound before you're 6 weeks along. But we will see you and get your all of your history, and we'll do some lab work if you wanted to do that before 6 weeks. How often are your visits? Most providers will see you every 4 weeks until you get to about 28 weeks, every 2 weeks until you get to 36 weeks, and then every week until you deliver. Obviously, if something comes up in the pregnancy, if there's any concerns, if you develop any kind of complications, you might be seen more often. So during COVID, a lot of questions have been about, can your partner come to the visits? At this time at our clinic, yes, for OB appointments, you are allowed to have one person with you. We are requesting no children at this time still, but those things are changing, as things go on. So that might be different later on down the road. And at Good Shepherd right now, you're also allowed to have one support person, and you can also have a doula as long as they have a certification. Again, those things are changing, so always stay up to date on our website, and we'll be talking about that as time goes along. When should you expect ultrasounds? This is kind of a big question we get a lot from women. Some women expect to get ultrasounds at every visit. Some women have no idea. So typically with a normal pregnancy, you would get an ultrasound to date your baby, which would be again around 6 weeks at the least. Then you're going to get an ultrasound around 18 to 20 weeks, and that's when we call this the anatomy ultrasound. By 18 to 20 weeks, everything is formed in the baby, all the organs. So we like to look at everything. We measure the baby, we make sure the baby's weighing appropriately, that everything has been developing normally. So that's kind of your big ultrasound. We usually then will do another growth ultrasound somewhere between 28 and 32 weeks to see how the baby is measuring. And then from there, if there are other issues, you might get more ultrasounds, obviously, but those would be the three most common kinds. Along with that 28 to 32 week growth ultrasound, we typically try to do a little 3D ultrasound for you as well. When should I be worried? Well, I couldn't go over every single one for you, but in the beginning, most women are worried about having a miscarriage. So I'd like to talk about that because that's usually a lot of the questions. Some women are concerned about vaginal bleeding and cramping. When is that normal? When is that not normal? And I'm going to kind of get into that in the next slide. If you're ever concerned, you could always call your provider and leave a message. And if we can't get a hold of you, then we'll call you back. Do you have any other things that you have? Okay. We're going to talk about some of this as we get into the specific trimesters as well. When do I start taking a prenatal vitamin? Ultimately, optimally, I should say, you should start taking a prenatal vitamin prior to pregnancy if you know you are trying to conceive, so that all of those nutrients are on board. But start taking one as soon as you know you're pregnant. A lot of the prenatal vitamins that you can get over the counter are actually pretty good. We do recommend one that has at least 400 micrograms of folic acid and 30 milligrams of iron. That's usually the standard. And then after that, most of them have your typical nutrients in them. If you have any questions, though, you can always ask your provider about their recommendations. Do I stop taking medications? Again, this is specific to the patient, but I would recommend not until you talk with your provider. If you do know you're pregnant and you're unsure, I would call and list your medications to see which ones you should stop and which ones you should not stop. Not all medications should be stopped during pregnancy. So we're going to get into like more specific first trimester topics. Up to the next slide. There we go. Okay, so common discomforts and self-care measures. The biggest one with first trimester is nausea and vomiting. We recommend taking a B6 vitamin along with a Unisom tablet. You can have that every 6 hours. That's the most, I would say, homeopathic, besides doing like a lavender essential oil, making sure you're eating every 2 to 3 hours. That's a big one as well. Most women, when they're feeling nauseous, they don't eat, which actually exacerbates the nausea. So right when you wake up, very first thing in the morning you want to do is you want to have crackers or a piece of toast, something bland, maybe oatmeal, and you want to start your day off like that. And you never want to go more than 3 hours without eating something. Carbohydrates actually help a little bit with nausea. You shouldn't eat all carbs, but they do actually help. Sugar and carbs help with nausea. You can do ginger, and you can either take that in a little cough drop they have, not cough drop, but it's like a little lozenge. Ginger lozenge, people find those really helpful. Peppermint is another one women find really helpful to smell or to have like a peppermint candy. Of course, there are medications that you can take as well, but I would try all of these things first because most of the time you just need to eat consistently and you'll feel a lot better. And sometimes you don't feel good no matter what you do. So unfortunately, that's part of the pregnancy, but it does go away for most people, so just hang in there. You will also get your dating ultrasound like we talked about, at least 6 weeks along. Lab work is typically done at your first visit. Lab work looks like your blood type. We do something called a CBC where we looked at your blood. We make sure you're not anemic. We also look for, we do test you for HIV and syphilis. That's common, along with seeing if you're rubella immune. Rubella is the German measles, so we want to make sure you're immune to that because it's something that you don't want to get during pregnancy. If you're not immune to it, that's okay. We just want to know, and we can offer you that vaccine after your pregnancy because it is a live vaccine and we can't offer it during pregnancy. So these are just really common labs. We'll get more specific if you have something going on. We might draw something else, but that would be kind of your basic labs. Okay, so here is what I was talking about before, vaginal bleeding, when to be concerned. This is a huge question we get all the time. So I would say it's not uncommon to have vaginal bleeding in the first trimester. Sometimes with intercourse, women experience vaginal bleeding, and sometimes with something called implantation. Implantation is when the embryo is implanting inside your uterus and the placenta is forming. It can actually break some blood vessels and be shown as some dark red blood. There are a lot of women that get this. When I would be concerned would be when you have abdominal cramping along with bright red vaginal bleeding. Those two things combined would be concerning, and I would go to the ER. But if there's ever questions, you can always ask your provider about when to be concerned. But there are a lot of women who experience vaginal bleeding, and it's not always abnormal. And it doesn't always mean you're having a miscarriage. Genetic testing. This is another question we get a lot. We usually do that around 10 to 11 weeks, sometimes 12 weeks, depending. This is when most people find out what they're having, and they do those gender reveal parties, but genetic testing is actually for genetics. So this is looking at your, what we call trisomies. So your trisomy 21 is very known as your Down syndrome, but there's also a trisomy 18, a trisomy 13. There's microdeletions that we're looking for, and some other common genetic disorders. If you have something really specific in your family, let your provider know, because there's other additional tests that we can do. But this would cover kind of your main genetic disorders. So some common questions. Most of that is around miscarriage and what medications can I take. There are a lot of medications that are safe in pregnancy, or we would want you to continue, especially with your antidepressants. I would not go off an antidepressant until you talk with your provider first, because it may be that you can continue on that, or it might be so that we can switch you to something else, but not leave you without anything for weeks and weeks before you see a provider. So I would always ask your blood pressure medications. I would not go off your blood pressure medications until you talk to your provider. There are blood pressure medications that you can take during pregnancy that are safe. Not all of them, but again, this would be something you would want to contact your provider when you get pregnant.
Asthma medications as well.
Okay, so nutrition, hydration, weight gain. This we're going to go through every trimester. So nutrition, you do not need a bunch of extra calories in your first trimester, unless maybe you're having twins. So the first trimester, you can kind of just do your normal caloric intake, but obviously you're going to want to be eating fruits and vegetables and healthy carbs like whole grains. You're going to want to really take care of your body this time, because your baby needs you to have all of those nutrients, and you need to have nutrients yourself. You want to stay as hydrated as possible, drinking, some people even say up to a gallon a day of water. That's kind of hard to do, but it is recommended. I personally have a hard time doing that, but it is recommended to drink as much as you can of water, and not juice, not sugary drinks, because that can actually dehydrate you more. You want to stay away from diet sodas, for the aspartame, and B, because they have a lot of sodium in them, and they can actually dehydrate you more as well. So really want to increase your water intake. Weight gain. Some women gain between 2 to 5 pounds their first trimester, and some women don't gain any weight. And some women actually lose weight if they have a lot of nausea and vomiting. But you don't necessarily need to gain more than that. But again, every pregnancy is different and every woman is different. So there's not an absolute norm. It's on a trajectory, just like everything else. So we're going to go into second trimester. Again, this is just kind of a brief overview. This isn't anything really in-depth today. Common discomfort. This is typically when women start feeling these changes in their body that are affecting their daily lives. Sleeping can get more difficult. Usually you can't sleep on your stomach anymore. You're going to want to start sleeping on your side. Women experience what they consider round ligament pain, or even Braxton Hicks sometimes hitting around 20 weeks. That's that cramping kind of in your lower abdomen. This is when your uterus is stretching, and this is very common, and this is very normal. When it wouldn't be normal is if you were having severe abdominal pain, especially if it was accompanied by vaginal bleeding. But your uterus is growing and stretching, and your uterus is mostly made up of muscle fibers. So it also can contract, and it can when it gets dehydrated or when it gets overworked. So sometimes you just need to rest and drink some water. And sometimes it can contract when you're not doing enough and you need to get up and move around. So that's usually one of the most common ones we have during the second trimester. You start feeling a little more short of breath as your body is increasing all of the blood that it's increasing and fluids. You're gaining a lot of water and fluid weight, and that can really make it difficult to walk upstairs. You're going to feel short of breath. Sometimes people experience palpitations, like those heart palpitations. That can be common too as your body is adjusting to the fluid intake. Some people experience lightheadedness at times. Those can all be very normal as well. Do you have anything else with the second trimester?
Mm-hmm. I think it's really important with the second trimester, especially that you're eating every 2 to 3 hours to keep a good, stable blood sugar, so that you don't feel those periods of lightheadedness, dizziness, like you're going to pass out. A lot of people want to skip meals, and they say, well, I'm just not hungry. Your baby always needs you to take care of it by eating every 2 to 3 hours. Not huge meals. Focus on protein more than anything, and just a small something to keep your blood sugar stable.
As far as weight gain, again, this is, every woman is different, but nutrition-wise, you should have about 300 extra calories a day. So it's not 1,000 extra calories a day. 300 is maybe like a half a sandwich. 300 isn't a lot. So just remember that and make those calories count, like Selena was saying. Make them protein, make them nutrient-rich calories, and stay hydrated. Again, continue that water intake is really important, especially when your Braxton Hicks might start or other discomforts. Water is going to help keep you hydrated and will help with some of those discomforts. Preterm labor is something that can happen during the second trimester as well. Typically, this is more towards the later end of the second trimester and early third trimester. Signs of preterm labor would be obviously contractions. Contractions are different than Braxton Hicks in that contractions don't go away and Braxton Hicks do. And usually Braxton Hicks are painless. They're a tightening of your uterus, but actual contractions can be painful. And as labor increases in intensity by nature, so it's going to be something that gets worse and worse. And those contractions are typically going to get closer and closer together. If you're ever concerned that you are in preterm labor, it's important for you to call your provider or go to the hospital. Usually we do your PAP and some vaginal cultures during the second trimester. Every provider is different. Some providers like to do these right away at your first visit, and some providers like to wait. But it is something that we'll try to update during your prenatal visits if you haven't had a PAP, and we usually typically will always do vaginal cultures. Your glucose test. So this is that diabetes test that you might have heard about where you have to come in and you drink that drink that everybody complains about. So what is gestational diabetes? So in a nutshell, your placenta is going to be releasing some hormones that can affect your body's ability to metabolize glucose and also can make you actually insulin resistant, which is similar to an actual diabetic. It doesn't mean you've done something wrong. It is something that has to do with your placenta. And so usually around 24 weeks is when we would start seeing those changes happen. Some providers like to wait a little bit longer, up to 28 weeks before they do that. That visit's going to look like you drinking a sugary drink and then us testing your glucose about an hour later. And then we'll let you know from there. If you do develop diabetes, we'll go over all of those things with you about nutrition plans and checking your sugars. A lot of times women are able just to adjust what they're eating and help just maintain their normal glucoses that way. And sometimes you do require medication, then some women even require insulin, just like a normal diabetic. As far as nutrition, we talked about that and weight gain. Again, weight gain is different for every woman and it just depends. This is usually the second trimester. There is some growth spurts that your baby is going to go through. So you are going to gain, you are going to notice some weight gain your second trimester and sometimes even more than you will your third trimester. And that's not uncommon. Do you guys want to?
We have a question.
Can you have caffeine while pregnant?
You can have caffeine while pregnant. They recommend that you limit it to, I think it's 1 cup of coffee a day, which is how many grams of caffeine? I can't even think off the bat. But if you're going to be somebody who drinks Spark, I would drink one of those, but not coffee. You have to limit what you're going to drink. Caffeine, it has been, in some studies linked to miscarriage in first trimester, but that is not substantiated. So I would just say limit it. I love coffee, so I'm never going to tell you can't drink coffee. Ever. So you can come and see me if you want to drink it.
But basically the equivalent of caffeine that is in 1 cup of coffee.
Okay, so we're going to move on to third trimester. That's a great question. Third trimester, common discomfort. So this is really when most people, especially if it's not your first baby, are going to be experiencing those Braxton Hicks. And they can be very annoying. Things that you can do to help with that, again, we're going to go back to hydration. Your uterus is a big muscle. So think about when you used to run or play sports and you would get those cramps in your legs. That's kind of essentially what's happening to your uterus. You're overworking it and you're not staying hydrated. So resting and hydrating is important. And also sometimes you do need to get up and you need to move around. That can also cause Braxton Hicks. And sometimes nothing you do You just have them because your baby's moving and causes them, or sometimes your body is actually contracting to help your baby move into a better position. So if you're lying down at night and you're having contractions, try moving to a different position. Also, you can take a warm bath. You can, again, stay hydrated. And then if they don't go away after 2 hours, I would call the provider or go into the hospital and make sure this isn't preterm labor.
One of the things that you can do also is make sure that you have a good maternity support or maternity belt, because if you have the extra support to hold your baby a little bit better and also counter pressure against your back, you're less likely to have as much pelvic pressure and as many Braxton Hicks contractions.
Yeah, maternity belt is great. And most women forget about that and don't use one, but it will really help, especially when you're up and active, walking around or going to the grocery store. It's going to really help support all of those ligaments and help with those Braxton Hicks. It's not going to take every pressure away or pain away. I also recommend to my patients to do prenatal yoga, and I think you should start that in the first trimester. Your body's going to be going through so many changes, and if you start earlier on with prenatal yoga and stretching, it's going to help you significantly when you get to the third trimester with just the discomfort of carrying that baby. So, and it's YouTube, you can YouTube prenatal videos, and there's tons of them on there, and they're free. And you can just do 10 to 15 minutes a day if that's all you have, and it will really help your pain third trimester.
There's also a resource called Spinning Babies, and you can go to the Spinning Babies website. And what she really emphasizes is making sure that your baby is always in the right position so that you'll have a more efficient labor. So she has different strategies and different techniques and positions, exercises for you to do to make sure your baby's in the right position. The other thing about a maternity belt is while it's really, really hot, people think that they're very uncomfortable and they don't want to wear them. You can't just wear it one time and expect a miracle. You have to kind of use it every day and let your body get used to it. We do have a resource here in Longview, Women's Health Boutique. You can go there. They will help you get a maternity support that is right for you, and they'll send your provider a prescription so that it can be signed off, and your insurance will be presented with that to take care of it.
And on that note, they also have breast pumps, and they also have, they will, again, send your provider the prescription, and you can get your breast pump there as well. That's a really great resource that we have in Longview. Usually we do a little bit more lab work around that 28-week mark. We're going to test you again for anemia, which usually becomes a problem in the third trimester. Your body is using so much of its resources to make this baby that you yourself start to suffer in the third trimester. And one of those things is anemia, where your body doesn't have enough iron of its own to make its own blood cells. So this is usually when we would prescribe some extra iron or ask you to take some extra iron over the counter. It's important in the first trimester that you get a prenatal vitamin with 30 milligrams of iron. This will help as the trimesters go by for you not to deplete all of your iron stores. Iron is needed for your body to rebuild blood. So once those stores are gone, it's very difficult for your body to remake the blood that it's been lost. So we recheck you for that. We also do recheck you for HIV and syphilis, usually during this time. It can take up to 6 months for that to become positive. So we test you in the beginning of pregnancy, and then it's recommended for us to test you again around this time so you can be adequately treated. Again, like I said earlier, you'll get a growth ultrasound with a 3D ultrasound around this time as well, and that's usually a really fun visit for women, and they bring their families. With COVID, you can bring your partner for right now, and you can take those pictures home. GBS, this stands for group beta strep. We usually do this around 36 weeks. Group beta strep is a common bacteria that some women have down in their vaginal and anal area. We will swab you with a Q-tip. It's not something that typically causes a lot of problems for women, and usually women have no idea that they have it. They found a while ago, I think it was back in the 1970s, if I'm correct, that babies who were born to women who had that GBS down in their vaginal area, they could actually become septic from that and become sick. And so it's actually very easy to treat group beta strep with penicillin. So we just swab every woman now. And if you have it, that's okay. We just need to know so that we can treat you during labor. You'll get some antibiotics. You'll get penicillin specifically. And if you have an allergy to penicillin, there's other options as well to treat that.
And that medication is not necessarily for the mom, but for protection of the baby. Because once the water breaks, then the baby is exposed to group B strep. Group B strep is actually a bacteria that about 50 to 60% of adults carry anyway. It does not make us ill unless we overgrow it, and then we tend to have bladder infections from it. But babies don't have a bacterial colony, and that is one of the ones that can cause them to become very sick. And they have pneumonia-like symptoms, and it can be, in very rare cases, fatal.
So weekly visits usually start around 36 weeks. Again, if you have something going on, if there's a complication in your pregnancy, these could start at 32 or 34 weeks. Sometimes as early as 28 weeks, but typically not, unless it's something very complicated. And then labor signs is another question we get a lot. When do I go to the hospital? When am I in labor? I do feel like women need to trust their intuition. I think there is something that women know that this is something different. These Braxton Hicks are different. These are different than the contractions before. So a lot of women come and they've been having Braxton Hicks since they were, let's say, 28 weeks. How do they know their labor? It's going to be something different. Labor by nature is progressive. So it's not going to stay the same. Those contractions are not going to stay the same. They're going to get closer and closer together, most likely, and they're going to get more and more intense. One or the other or both. And I think there is a shift that happens that women know that this is something different. Or sometimes women's water will break and they're not having any contractions. That's another reason to go to the hospital. The other major reason to go to the hospital in the third trimester is if you're not feeling your baby move. You should be feeling your baby move every day from 28 weeks on. They should have a pattern by that point. Pay attention to your baby's movements. When do they move? When do they not move? So that you know this is something different. My baby usually is always moving at this time. Pay attention to those things. Those are important signs that we want to know about. And if there's ever a time you're concerned, we want you to go to the hospital. If it's been a few hours or you don't know, you can always lay down on your side and see if just laying down, you can feel your baby move. Sometimes we're up and we're active and we're moving around that we're not really paying attention to our baby's movements. And it's just that we need you to kind of just sit down and lay down and really just see if our baby's moving or not. But if there's ever a question, we'd rather you go to the hospital. Nutrition, you typically need about 500 extra calories a day during your third trimester, so this is increased from your second trimester. Hydration is the same. Gallon of water a day is your goal. You'll get a gold star if you can do that. Weight gain, some women don't gain as much their third trimester, especially those last few weeks. And some women do gain weight. Everybody's a little bit different. It depends on what you came in weighing. And that's something to talk about your provider about because it can be kind of as patient specific. What's normal weight gain for me? What should my goal be? Average you always hear is 20 to 25 pounds. Sometimes yes, and sometimes 40 pounds is really normal for a woman to gain their first pregnancy or during a pregnancy. So it doesn't necessarily mean you've gained too much weight if you've gained more than 25 pounds. And some women don't need to gain more than 10 or 15 pounds. So it really just depends on what's going on.
If you're really overweight too, and you're eating healthy and exercising like you should, you might even experience weight loss. Even if you haven't been sick, your body just kind of sometimes reproportions and is just in a better place because you're taking better care of yourself. So as long as your baby's growing, which is the purpose of prenatal care so that we can make sure your baby's growing well, you don't have to worry about that. It's pretty normal for you if you're not sick, that you are taking good care of yourself.
We do have some questions from the ladies. One of them was, what happens if she's breech?
If the baby's breech, there are, Selena mentioned a website called Spinning Babies. There are actually things that you can do for a breech baby to try to flip this baby on your own, different positions that you can do at home. There are also some women qualify for something called aversion. Aversion is when a physician would actually manually try to flip your baby with their hands on the outside of your belly. That's also a possibility. Not all women are candidates for that, and it is something that a physician would have to do at a hospital. If your baby is still breech, that would be when we would be talking about having a C-section, because we cannot deliver, a breech baby knowing that it's breech if it's only one baby. So that would be what would happen.
One of the reasons why we cannot do breech vaginal deliveries, especially with first-time moms, is because the baby's head is the biggest part of the baby. And because the pelvis isn't proven, we would not be able to know for sure that you could deliver the baby's head, because the smaller part of the body would be coming out first. And that's a question that a lot of people have in regards to breech. If you were pregnant with twins and you're a candidate for vaginal delivery with twins, and baby A is head down and baby B is breech, there is still a possibility that you can deliver vaginally. But again, you have to be a good candidate. It's something that your provider will talk to you about, and you will make a plan for.
And I will say too about breech, often throughout the pregnancy, if we have an ultrasound, it's reported that the baby is breech, like at the 20-week scan. Moms are often anxious. It doesn't mean that the baby is going to stay breech at the 20-week scan. That's part of why we do the 32-week, and that's also part of why we put our hands on you every visit to see how the baby is positioned. The baby has a lot of room to move until 36 weeks-ish, and so it's possible the baby could be in multiple positions up until that point.
Okay. Any other questions? Okay, so the next slide, we want to know what questions you have. Just in general, if you're somebody who's just watching this later on, we'd love to hear from you and answer your questions. We'd love to know what topics you want to hear about in the future. We have tons of ideas, but we want to know what you want to hear about. And we'd love to just do another video, keep doing these videos, talking about different things. Another question we want to know is, what is the most important thing to you in choosing a care provider in hospital? Those are important things. We want to know what's important, what do you think about before you choose a hospital or a care provider? We want to talk a little bit about choosing CHRISTUS, Good Shepherd, for your delivery. Why would CHRISTUS Good Shepherd be a place to choose for your delivery?
With question?
Okay.
Okay. All right. This question is, what is the best suggested sleeping position and sitting position so that the baby is safe? Is there any particular sitting position to be avoided?
It's really important when you're pregnant, especially in that third trimester, to sit straight and not slump. When you slump, your baby kind of falls into a posterior position, which if the baby remains there, then you have a longer, more difficult labor. And sometimes the baby will get into a posterior arrest and not be able to even be born. Most of the time they can, but it just is not as an efficient labor because the baby doesn't fit as well. So it's really important to use good posture, sit straight, even get a high-backed chair and sit backwards on the chair and lean forward. Sit on a birthing ball or an exercise ball, which will put your body in the best position for your baby to rotate to the correct position that it needs to be. In sleeping, we always hear not to sleep on your back. The bottom line is that it's the more efficient way and better for circulation is to be on your left side, because the uterus is displaced off the major vessels in the body. However, if it's more comfortable for you to fall asleep on your back, what happens is the uterus actually falls against the major vessels, and it can occlude perfusion to the baby and yourself so that your oxygen level isn't as high. Logically thinking, when you're not breathing well, you're going to adjust your position. Even if you're in a dead sleep, you're going to adjust your position. And so don't focus so much on how you're falling asleep and sleeping as much as you are getting good sleep. Do all the things that you need to do to make sure that you have a restful night's sleep. Don't worry about the position as much.
Okay. We have another question. How can I stay hydrated with pure water and still get enough electrolytes?
Well, water does have electrolytes in it. It's not just water. And electrolytes mostly come from food. So your fruits and your vegetables have a lot of electrolytes. You don't necessarily, unless you're vomiting and having diarrhea, you don't necessarily have to drink extra electrolytes during pregnancy. you will be able to get those just from your daily normal nutrition and from water. If you're experiencing leg cramps, or some people even experience restless leg, that is when I would say you could possibly try to eat a banana or increase your electrolytes as well. But for the most part, you're going to get what you need.
A lot of times those leg cramps are just go back to not having enough water. One of the things that people always think you need to have potassium for leg cramps, it's really actually calcium and magnesium. It's okay to have all of those things, but you can add a magnesium supplement, about 400 milligrams, but at night before you go to sleep. It'll help you rest better. It'll help with constipation. It'll help with leg cramps. But remember, water is probably the most important thing with that.
We have one comment that they'd like to hear more about breast pumps and breastfeeding.
Great.
It says, I have one of those snuggle pillows that has been very helpful with getting comfortable while sleeping. And then another question is, are you offering hospital tours at this time? So right now, if you're able to, I feel like I'm talking behind the camera. So right now, if you are able to get online to see our virtual tour, that is very helpful. With COVID-19 and keeping you and your baby safe, they're really not recommending people come to the hospital until it's time for your care. But we will keep you posted. So if you will stay tuned to our hospital website as well as our midwives website, as we are able to update that and change and open up our hospital more, as advised by the experts, we'll keep you tuned and let you know what those changes are.
That's a great question. And we would love to, the plan originally before COVID was we were planning on doing those tours ourselves and planning on doing the birth classes. So that is something we still want to do in the future. Right now, obviously, we have some restrictions. So this is why we're doing this today. We want to start talking to you all about topics that you want to hear about, doing these virtual, basically birth classes. So instead of you coming in and sitting there listening to us for 2 hours, we can just do these short topics, and you can tune in when you want and not tune in when you don't want. And we want to just be talking about topics you're interested in, and breastfeeding and breast pumps are a big one. And we were already planning to do a topic on that for sure.
We also plan to have guest speakers from time to time on those topics. So we do have lactation consultants at CHRISTUS Good Shepherd. And so when we have that topic, which will be soon, we will invite one of them to come and visit during that session as well.
Okay. I am presently having Pregnamax multivitamins, which has iron of 17 milligrams and vitamin D of 10 milligrams. Is that sufficient? If more, is it recommended for supplements over the counter?
There is an iron supplement over the counter that I would recommend, because if it's only 17 milligrams of iron in there, later in pregnancy you probably will drop below what we would like to see your iron level be. There's an iron supplement called Gentle Iron. Gentle Iron, you can buy it anywhere over the counter, and it is a combination of iron, vitamin C, which makes it absorb better, and also a stool softener, so that when you're taking that iron, you're less likely to be constipated.
It is important when taking an iron supplement that it's actually absorbed in your body. So if you don't take iron at the right time or with the right types of foods, sometimes it doesn't actually absorb. So vitamin C a lot of times will come with the iron, and that's something you want to look for when you look for a supplement. And iron can make you very constipated. So it's great to have kind of all of those three things in one supplement.
Sorry, could you repeat the name of the iron tablet, just the one that you just said?
Gentle Iron.
Gentle Iron. And I can get that over the counter, right?
We can go to the next slide.
So why would you choose CHRISTUS Good Shepherd for delivery? I think there's a lot of reasons. We're just going to do a brief overview why we love CHRISTUS. We offer a birthing tub, which isn't any other hospital does not offer. Birthing tub, you have to meet criteria, but we have a tub where you can labor in. And you can't deliver in the tub, but you can labor in the tub. Also, we have a staff that supports natural labor and is comfortable with natural labor if that's something that you want. This is a staff that is dedicated to being your support person along with us and your provider. And you're going to have the tools that you need. We have birthing balls, we have peanut balls, we have squat bars, we have all types of things to help you with your natural labor at CHRISTUS Good Shepherd. We have newly remodeled rooms. They're beautiful, they're big. We think you'd really like the birth suites that we offer. We also have an OB physician that's on site 24 hours a day, which no other hospital offers. So there's always going to be a doctor available. Even if it's not your own physician, it's going to be a physician if there's an emergency, readily available to help you and your baby. It is also a faith-based community, if that's something that's important to you. We are a Christian-based organization, and so that's something that we can offer as well. So again, topics we plan to cover. We want to talk about, obviously, birth plans. We want to talk about natural birth. We want to talk about epidurals as well. We want to talk about breastfeeding and any other topics that you're interested in. We are open to hearing from you and addressing those topics in the future. I don't think we've scheduled a date of our next Zoom session, have we?
We're going to do this same Zoom meeting every week for today and 3 more weeks. And we want to see how it goes, and then we'll adjust it after that. But same time, Thursday mornings, we're going to be here. Tell your friends, share the link with other people, and send in comments and send in ideas for topics, because we would like to cover the whole pregnancy, labor, delivery, and some newborn stuff during these first 4 sessions.
Yep, so again, send us feedback, send us what you want to hear about, and we've already kind of covered the virtual orientation, so plans for that. We would love to be able to offer an in-person, but the virtual orientation is in place right now.
Also, if you're not our patient and you're interested in using CHRISTUS Good Shepherd as your delivery place, or you're interested in coming in as a new patient, transferring care, whatever it is that you need to do, you're welcome to call in and make an appointment and come in for a consultation and meet with one of us, or you're just welcome to make an appointment and go ahead and get started. You're always welcome here.
Okay. All right. If there's no more questions, we're going to go ahead and sign off. And again, we're going to see you next week at the same time, 10:30 on Thursday. We're going to go over what we've gone over today again. Tell your friends, or if you want to listen again because you have more questions, then we can answer those in person. We'd love to hear from you, and we're just really glad to be able to provide this meeting for you, and look forward to more in the future.
Sorry, I have a last question actually.
Yes.
Right. I was the one who was asking about the iron intake. I couldn't follow what exactly you said, if it's an excessive intake of iron, the consequences, the side effects of it.
The consequences or side effects of your iron intake.
Some women experience constipation when they take iron. So the gentle iron that Selena was talking about actually has a stool softener with it, which is why it's recommended, so that it helps you not become constipated with the iron. Some women experience just GI upset in general. So it's important to take it with other vitamins, especially vitamin C, and not take it by itself with water.
Does that answer your question?
Right. Yeah. Thank you so much.
Okay. Okay. All right. Well, we will see you next week then at this time. Have a safe weekend, and we'll see you next week.
Bye-bye.
Bye, guys.